The next one is the muscular dystrophies can be inherited in three ways. First is autosomal dominant, and the second one is autosomal recessive, and the next one is the X-linked or sex-linked recessive inheritance. First one is autosomal dominant inheritance, in which when a child receives a normal gene from one parent and a defective gene from the other parent. Autosomal means the genetic mutations can occur on any of the 22 non-sex chromosomes in each of the body cells. Dominant means only one parent needs to pass along the abnormal genes. The next one is the autosomal recessive. The next one is the inheritance means that the both parent must carry and pass on the faulty gene. The parent each have one defective gene but are not affected by the disorders. Children in these families have a 25% chance of inheriting both copies of the defective gene and a 50% chance of inheriting one gene and therefore becoming a carrier able to pass along the defect to their children. Children of either sex can be affected by this pattern of inheritance. The next is the X-linked or sex-linked recessive inheritance occurs when a mother carries the affected gene on one of her two X chromosomes and passes it to her son male, always inheriting an X chromosome from their mother and a Y chromosome from their father, while daughters inherit an X chromosome from each parent. There are the many types of the muscular dystrophy. First of is Duchenne MD is the most common childhood form of MD as well as the most common of the muscular dystrophies overall, accounting for approximately 50% of all cases because inheritance is X-linked recessive caused by a mutation on the X or sex chromosome. Duchenne MD primarily affect boys, although girls and women who carry the defective gene may show some symptoms. About one-third of the cases reflect new mutations and the rest run in the families. Sisters of boys with Duchenne MD have a 50% chance of carrying the defective gene.